On October 16, 1992, I went to see my OB/GYN for an annual exam. Dr. Meyer noticed a slight weight gain. She began asking some general questions as she completed her exam. During the exam, she checked my neck. She felt a small lump about the size of a pea on my left side. She referred me to my primary care doctor to see about it. I had surgery 10 days later to remove 2 malignant papillary tumors. I was 22 years old. What I'm going to talk about is important because thyroid cancer is the 8th most common cancer in women, and the numbers are rising every year. As a cancer survivor, I have spent the last 20 years learning all that I can about this disease. I am going to talk about the importance of your thyroid gland, what the risk factors for thyroid cancer are, and how you can educate yourself. According to a Mayo Clinic article published in 2011, your thyroid gland is a butterfly-shaped gland located at the base of your neck below the Adam's apple. Your thyroid is responsible for producing hormones that regulate your heart rate, your blood pressure, your body temperature, and your weight. The thyroid gland is a major part of the endocrine system, and as with all glands or organs, sometimes things go wrong. Thyroid cancer in its earliest stages may show no symptoms, but as it progresses, it may cause a lump that can be felt through the skin on your neck, changes to your voice, including increasing hoarseness, difficulty swallowing, pain in your neck or throat. If you experience any of these symptoms, please see your doctor for a full evaluation. The causes of thyroid cancer are not completely clear, although the rates are increasing. There appears to be a link between a higher rate of cancer and nuclear power plants. There is a greater incidence after a fallout incident. There is also a greater risk of thyroid cancer in people who have had a large amount of radiation concentrated close to their necks. It is important to note that this is a correlation, not a cause. But there is good news. MD Anderson Cancer Center in 2012 said that according to the American Cancer Society, about 45,000 people are diagnosed with thyroid cancer each year in the United States. About 75% of them are women, making it the 8th most common cancer in women. Thyroid cancer is seen most often in adults, with 2/3 of the cases occurring between the ages of 20 and 55. Although thyroid cancer accounts for about 1% of all cancers, it is becoming more common. At least 450,000 people in the United States have completed treatment or are living with thyroid cancer. Thyroid cancer is usually a slow-growing cancer. It is one of the least dangerous cancers in most cases, and the 5-year survival rate for cancer is almost 97%. Joan Shea is one of those survivors. On her website, checkyourneck.com, Joan Shea shares that she is a thyroid cancer survivor. She began the Light of Life Foundation to educate and promote awareness and support for thyroid cancer patients and promote public awareness of this growing disease. She encourages people to check their necks for lumps and bumps. Her Check Your Neck ads have been in major magazines and promoted in a popular radio PSA featuring thyroid cancer survivor Rod Stewart. In closing, I have talked about the importance of your thyroid gland, what are the symptoms and causes for thyroid cancer, and the good news about thyroid cancer. I hope that you leave here today more informed about your thyroid gland, and don't forget to check your neck.